Hi, my name is Monica Tadros. My student ID is 220387111. In this presentation, I will first discuss the assessment findings during Mrs. Teresita Manalo's admission to the hospital 2 days ago. Mrs. Teresita presented dizziness and palpitations. A 12-lead ECG was performed diagnosing Mrs. Manalo with atrial fibrillation leading to an embolic stroke. Using the ATE framework, this presentation will focus on abnormal vital signs and their clinical significance. I will then outline the priority nursing interventions and rationales in managing her condition. Finally, I will discuss therapeutic management strategies, including 3 prescribed medications. To begin with question 1, I will discuss the ADE assessment for Mrs. Manalo. Starting with airway, it is documented as patent. Therefore, Mrs. Manalo can breathe properly due to the airflow passing through anatomical functions of the airway, showing with nil signs of distress. For Mrs. Manalo's airway to be maintained, the GCS must be 15 out of 15. As revealed in the handover, Mrs. Manalo has a decreased level of consciousness and GC score of 12 out of 15 with slurred speech. The National Stroke Foundation uses the FAST test as a form of efficient stroke management, which Mrs. Manalo presents slurred speech and unilaterally droop. Due to the observation airway can quickly become compromised as indication of diatheria and reduced level of consciousness. As nurses, reassessing Mrs. Manella's airway patency is vital as airway management can stabilize Mrs. Manello using airway management methods such as nasal prongs and calling for rapid response if needed. Moving on to breathing. Her respiratory rate is elevated at 26 breaths per minute, revealing a state of tachypnea and oxygen saturations of 95%, with airway entry of decreased in right lung bases showing shallow respirations. Mrs. Manalo is being managed with 6 litres per min via Hudson mask. According to evidence-based guidelines, tachypnea and shallow breathing indicate increased work of breathing, which may also be relation to neurological impairment or early signs of respiratory distress, which requires close monitoring and supportive oxygen therapy. Oxygen saturations appear to be adequate due to the current oxygen therapy, which is shown to be effective. If oxygen levels drop, increase ventilation and then assess oxygen status. These abnormal findings guide the plan of care by stabilizing airway and breathing. Mrs. Manalo's circulation reveals that she's tachycardic due to her heart rate being 132 beats per minute, which reveal how the irregular electrical signals in the upper chamber of the heart is related to the atrial fibrillation. Mrs. Manalo's vital signs also reveal hypertension of 170 over 95, further revealing that embolic stroke may be occurring. It is shown in Mrs. Manalo's vital signs that a cap refill is more than 3 seconds, but through touch and looking, Mrs. Manalo is preferably cool and is experiencing pitting in feet. According to these vital signs, it establishes that Mrs. Manalo's rapid and irregular pulse and pitting edema in the feet show poor cardiac output, causing an event of embolic stroke. Monitoring output and input of fluid intake is important as it may tell us signs of hemorrhage. Therefore, to manage circulation, IV access must be available. In the vital signs, disability shows a GCS of 12 out of 15 in EV, V3, and M5, with left-sided weakness, also known as hemiparesis. These signs shown in Mrs. Manalo's disability are signs of embolic stroke, which does affect the right cerebral hemisphere according to Considine 2024. Ensuring BGLs remain in normal range during assessment, it is important as hypo and hypoglycemia can worsen worsen neurological outcomes. Mrs. Manalo's exposure reveals that she is afebrile and has IV cannula in situ left cubital fossa, where she was receiving Hartmann's at 20 mils per hour. Exposure and vital signs help with full body assessments to ensure no trauma or skin conditions are present that could be making Mrs. Manalo's condition worsened. Ensuring that Mrs. Manalo has IV access is important if needed for rapid administration of medications or fluid. Be sure to review fluid balance before requesting or administering more fluids, as Mrs. Manalo is experiencing peripheral edema and perhaps cardiac dysfunction. Moving on to question 2, I will outline 4 high priority nursing interventions for Mrs. Manalo's embolic stroke. The first intervention is positioning the patient in semi-Fowler's position to optimize cerebral perfusion and reduce aspiration risk. Literature supports that upright positioning assists in airway management and oxygenation in stroke patients. A second intervention is conducting frequent neurological observations to detect early deterioration and doing continuous monitoring of GCS and vital signs every hourly to report any deterioration early. Evidence shows that early deterioration of changes in GCS is linked to improved outcomes of stroke progression or re-occlusions. Maintaining cerebral perfusion is an important intervention as it is vital to deliver oxygen and nutrients to the brain. Cerebral hyperperfusion can worsen if body goes into shock, leaving the body with poor circulation throughout the body, impacting Mrs. Manalo's current state. Therefore, the importance of heparin infusion's action is in an anticoagulant for Mrs. Manalo to help prevent another embolic stroke occurring. Keeping Mrs. Manalo nil by mouth can prevent aspiration. Having a speech pathologist review Mrs. Manalo can confirm whether swallowing will be safe for her. Furthermore, ensuring Mrs. Manalo maintain adequate oral care to prevent infection and checking bedside equipment such as suction in case of aspiration. Dysphagia is most likely to occur after a stroke as there is an impaired cranial nerve function which puts Mrs. Manalo at higher risk of aspiration pneumonia. Therefore, ensuring a speech pathologist visits Manalo early for swallowing assessment and management of oral care will promote safe nutrition management. Lastly, assessment, administration, and side effects when administering 3 of the following medications, which are heparin IV infusion, metropole 50 milligrams twice daily, and pantoprazole 14 milligrams daily. For each medication, I will outline the key nursing considerations, focusing on assessment requirements, safe administration, and potential side effects in relation to Mrs. Manalo's care. Heparin IV infusion treats embolic stroke secondary to atrial fibrillation. Before administering heparin IV, referring to Mrs. Manalo's baseline coagulation profile, such as APTT, INR, and platelets, as well as looking out for any signs of internal bleeding. After administering heparin, monitoring vital signs and neurological status, keeping an eye out for rapid deterioration and risk of hemorrhage. Heparin infusion must be administered as IV infusion pump to ensure accurate dosing by the institutional heparin protocol according to APTT results. During heparin infusion, it is advised to avoid intramuscular injections or invasive procedures to lower the risk of Mrs. Manalo's bleeding. Additional side effects that may experience is heparin-induced thrombocytopenia. Therefore, monitoring platelet count will prevent from occurring, as well as a local irritation of IV site. The second medication chosen for Mrs. Manalo is Metropole 50 milligrams twice daily. This acts as an oral beta blocker. Therefore, it is important to check baseline of heart rate and blood pressure before administration. Metoprolol slows down the conduction of the AV node. Thus, it is recommended to assess for further symptoms of bradycardia and hypertension, as well as reviewing Mrs. Manalo's cardiac rhythm and what her ECG findings are. To administrate metoprolol, it is best to give with food or after meals to help with absorption. According to MIMS 2025, metoprolol is to not be crushed or chewed, and after administration, it is important to monitor heart rate and blood pressure 30 to 60 minutes after. Some side effects Mrs. Manalo may experience are bradycardia, dizziness, and fatigue. Lastly, the medication I will discuss is pantoprazole, 40 milligrams daily. It is best for Mrs. Manalo to have before food and preferably in the morning to reduce acid secretion, and is best to be swallowed whole, not crushed, according to MIMS 2025. According to MIMS 2025, antiretrovirals or antifungal medications can disrupt the pantoprazole absorption process. Side effects that Mrs. Manalo should be aware about are headaches and GI upset. According to MIMS 2025, long term use can cause B12 deficiency. It is important that if Mrs. Manala experiences any of these side effects to notify notice nursing staff. It is important as nurses to ensure that Mrs. Teresa Manalo recovery is based on evidence based nursing practices through thorough assessment with clinical reasoning and understanding of vital signs and to ensure that recommendations are followed through. Thank you.